The chairman and chief executive of the National Drug Law Enforcement Agency, Brigadier General Mohamed Buba Marwa, retired, has asked all tertiary institutions in Nigeria to make drug integrity tests an institutional policy for both new and returning students. This is in furtherance of the fight against drug abuse among Nigerian youth. General Marwa, who made the call at the University of Abuja while launching the Drug-Free University campaign, also called for a partnership between the National Drug Law Enforcement Agency, NDLEA, and the university system to allow the agency set up outposts on campuses to further strengthen the authorities in fighting the scourge. He went further to say the theme Drug-Free University and Tertiary Institutions is apt and timely, as there is no better time than now to combat the drug challenge in the university community and among students. Joining me for more on this is Director General of Christ Against Drug Abuse Ministry, Dr. Dokun Adedeji. Good morning. Thank you for joining us.
Thank you for inviting me.
Right. There are a lot of persons who want to understand the why. Why higher institutions of learning, why this group of persons who find themselves in institutions like this, why are we beginning this kind of collaboration with institutions with this group of people?
I think thank you. One of the things we need to note first is if you look at the statistics, the people that are basically and specifically affected most are the people in that age group from 15 to 29. And then, so these are the people also in tertiary institutions who are in the productive sector of economy. And so it's important. And also looking at it from the point of view that these are the people that will be leaders of the country in future, we need to curtail the use of substance abuse amongst them before they become entrenched. If you also follow the news, about 2 months ago, the NYC announced that close to 60% or above 50% of coppers use drugs.
Right.
So you can begin to understand the prevalence of this situation. And so I think it's important for us to appreciate the need for this and why we ought to start it and do it. But one thing I also know from our discussions with General Marwa is the fact that this is not for a punitive purpose. Or it should not be for a punitive purpose.
It should not.
It should not be. And I don't think that's his intention. His intention is that people should come to a realization that we're in an epidemic. And then we almost join hands to do something about it. Not only institutions, because some of those people in that age group begin to work. People in NYC 2021, they'll be transferred to various locations to go and work. You can then imagine if you don't begin to deal with it, that becomes a seed of future abuse in any area they go, because they will start and then get others involved.
Interesting. And then now talk to us how this will, how much impact this will have on the curve of substance abuse in the country.
I tell you, it will be positive. It will be a good thing. I can tell from practical experience, because in the NGO that I'm involved with, we started this with universities many years ago, talking to them, particularly private institutions, that instead of expelling the students in final year, you expel them to go and do what on any various level they're in. So many of them responded positively. They started sending their students who tested positive to us. And then under the assertion that if we certify them, they will take them back to come. And a lot of them have completed their education. And many of them are living productive, like many are doctors and nurses and that today. And so you can imagine we didn't give them the second chance. What could have happened? So I think what Jeremiah is saying, can we institutionalize that kind of practice? That we begin to give these people a second chance? Not necessarily. You see, the thing that makes people run away from tests is because of the punitive nature. Substance abuse, as we keep saying, is a public health issue. And until we look at it in that perspective and then apply the same dimension of management, we'll be missing it. Then we keep it on the radar and people be using it and it become pervasive. So it comes to a basic understanding of the fundamentals.
Because from the reaction you get, especially on social media, where this group of people are active, for them it's like, why are they beginning with us? Isn't it going to infringe on our rights? Why this, why that, and all of it?
You see, some things are beginning to happen in the world that begins to tell us that there's a limit to freedom. When we say human right, I agree, human right. But where your rights infringe on the rights of others, then we need to put a boundary to it. What I'm saying is, I think the understanding of social media, I'm very skeptical about reactions on social media because they're mostly uninformed, and then people just make noise and they don't go to a full understanding. It's not as if the youth are being targeted. The important thing they want to know, maybe this is what we now need to do, which I think Jeremiah is doing, is to explain to people the necessity, and that is not being targeted. As long as they know there's not for punitive situations, people will surrender themselves, and it's to help them. Because I have seen it, where we have helped a lot of people, they'll turn out to be very good. Some of them are working today in various sectors of the economy. So that is I think the final goal we should look at. It is not the immediate, the youth have been targeted. Yes, I understand. Let me also tell you, one of the discussions we've had is that how do we start it from the top, that every political post, anybody aspiring for any position should be tested. In the concept of the Nigerian situation, that will be resisted, and there's no point go to start in a place and resistance starts, and then you begin to, it will never go down.
So it is from bottom top, that's approach, so to speak? So to speak.
In the context of, you see, these people are grown up. They can as well use drugs and die. But I'm sorry to say that, but what I'm saying is, we can't afford to sacrifice our young people who will take the reins of power in future, because now these people resist that they don't want. If they resist, or they say, no, why start with us? We are big people, we are legislators and whatever. They know themselves, I hope they know themselves, that we are in an epidemic. Many of them, look, in this country today, there's hardly any family that is not impacted by the consequences of what I'm talking about.
Absolutely.
So the best thing is that we all come together. This is not an NDLEA matter. It's a national issue that bothers us on national security. And look at what you said, just showed that happened in Ibadan. You think a normal person can just carry guns and begin to shoot? There's an induction of something that permits them to be so completely uncaring about the next person. And if we don't do something, we see what is happening to it. Look at the rate of rituals. Look at the rate of Yahoo. Look at these are symptoms of a major decadent issue that we need to deal with. Even substance abuse. If we then don't address it, it will be a major issue for us. I guarantee if we don't do anything in this country, 5 years' time down the line, people will be smoking openly, and then you can't do anything. You'll be shocked. At the level of use in tertiary institutions, you'll be shocked. There is no institution in this country that does not have a drug problem. They can run away from it. They can decide not to face the fact, but that is the reality. We know.
Right. Now, you said something that I'd like for you to expatiate on, which has to do with information, that a lot of these people are not informed. And the question is, with the works that have been done over the years, how much of advocacy does it mean that the advocacy that we have been trying to push with regards to substance abuse have not been making the necessary impact? Is there a missing gap in the process of things?
I think not a missing gap, but a misdirection of the information. I'll tell you why. Until we began to have a general discussion, stakeholders began to see that the way of disseminating information, one needs to be very careful. Before, it used to be the vogue that people can go into schools and be talking about drugs to young people. We found out that that is wrong from evidence-based work that has been done, because what you are doing, you are exciting their tendency, they are wanting to use it, particularly if you talk to young people. Oh, absolutely. If I go to an institution and bring someone who's used drugs before to come and talk about substance abuse, and the young people, the impressionable minds see the the glamour of how I've used it before, but now I'm clean. They say, oh, if you can get clean, why don't I try it? Some of the things they've never had before that you mentioned, then they want to try it. The curiosity sets in. So we need to, truly, we're working on every dimension of advocacy. Which one works? How do we do it? You see, the thing is, let me give you an example of HIV/AIDS. You know, when we had problems with HIV/AIDS, people were skeptical. Nobody wanted to come out to do any test because of the stigma attached to it. And so Professor Ransom Kuti then mentioned his own younger brother, and then people began to put a face to HIV/AIDS, unless we do that with drugs. What I'm saying is this: until we take away punishment from it, until we begin to let people understand there's a public health issue like diabetes that can be managed, and also that is prone to chronicity, that is somebody who's on substance abuse and also relapse, and then we manage it until the time that it gets to absolute recovery. If we don't begin to get people to understand that, and also to know, and also to curtail the general corruption in society about how these things can come in, how these things get sold, it's a multifaceted approach that is required. And that is what I think systematically we are getting into. And when we get the young people, and also, you see, the social media, as good as it is, has been extremely negative in the propagation of information. Because information you see is basically emotional and sensational, and that does not help. The thing also we need to begin to tell people is, if you tell people, for instance, if you take drugs, you go to hell. The guy says some people populate hell. Why then can't I go to hell? What is wrong with it? So we need to measure and then use the various components of society, the religious bodies, particularly because they see more people than I will go to.
And they are influenced, they wield a lot of influence.
Absolutely, but I guarantee you most pastors do not appreciate what we're talking about because everything is spiritualized. Oh, why don't you go and do deliverance? What do you deliver someone when you do not understand the fundamental of the problems? So the education should be so generalized and then suited to the congregation you're speaking with. Then we will get results. Right.
Now, there's another aspect that I'd like for you to talk to us about with regards to this. Parenting. How they coming in all of this, because some parents might also be resistant to things like this. How do they coming to ensure that we have a success, we succeed at the end of the day what we are trying to achieve?
I thank you for bringing the issue of parenting. I think the greatest danger today we face as a people is the poverty in the management of parenting. Parents are no more parents, and that's been factual. We say it all the time. When they bring their kids, even most parents, with due respect, need parenting in what we have said, because they themselves don't. Look, a father was called by an institution that I know that, look, your son was called. He said, why? I can't travel. Tell me why you want me to come. They said they found him. He said, oh, is that why you want me to travel all the way? I brought him to your school so that he can get corrected. Really? Imagine that. There's an institution in which when they were doing search, they found a lot of money on a student in dollars. How did he have it? You see, parents go to school to beat up teachers. Parents go to school to scold. There are certain schools, students cannot be corrected. Where did they come from? What parents forget is, what people forget in society, the cradle and the foundation of morality starts from the home.
Absolutely.
If we don't, look, this drug issue or any decadence within the society, the vices, if we don't correct from the home, we're in big trouble. That's one. And the only agency that is so close to them to monitor is these religious organizations. So the church today, particularly because I am a Christian, the church today must begin to focus their messages on parents, the society, relevant information. You see, when you go to church every Sunday and preach the sermon of Moses, of this, we can read that. But how is that incidental upon my daily living? if we don't get it to touch people, look, go to church and see young people in church. They're playing with their phones. Most of the times we're preaching above their heads. They don't feel connected. And how does it come? It comes from the home. Most parents don't see their children. Wake up in the morning, 5:30, they're off to Lagos. It's the nanny that takes care of the child.
Right.
And when by the time they return, the child has slept. Where is the connectivity? Weekend is Owambe parties and all those things. So how do you have connection with your kid? How do you influence them? Parents are the primary role models for these children. And when people shout about the youth and make noise about them, check the parents.
Homes. Interesting. Now, as it stands now, what is the framework that is in place for this to, you know, pick up as quickly as possible?
You mean the test?
Yes, this collaboration with institutions.
I think this is in the initial stage, and that's why the meeting was held using the Abuja institution to say it. I think the time will come in which NDLEA will meet with the vice chancellors of universities and principal officers of universities and let them understand that this is not a way of allowing you to just have all kinds of students, but it's a way of helping the nation and also helping the young people and their parents as well. Because if you do the test, you see, and the thing that we also need to let people know, these young people are getting smarter by the day. Let me give you an example. They know that some of the kits used in the universities do not catch certain substances. So the use of those substances are prevalent on the campuses. So they will test them, nothing happens. And also, they can read on the internet some sites, I don't want to mention this on
Definitely
TV,
not, yes.
in where they can sidetrack. They tell them the methods to sidetrack the testing. And look, they even tell them how to get synthetic urine so that they use
really?
Absolutely. I mean, we have that knowledge. I can tell you that for free. So we need also to be careful. And that's why I think what the general is saying, if you do as they come in, you do a random test when they are not aware that they're going to be tested. But let this be a framework of policy so that nobody is saying, oh, you're just targeting my child or something. It becomes a policy, which I also think the organizations, companies should incorporate to have a drug policy in their company, and it helps them in managing this issue.
Absolutely. There's so much to talk with regards to this, but we'll have to leave the conversation here now. Thank you so much, Director General of Christ Against Drug Abuse Ministry, Dr. Dokun Adedeji. Thank you for your time.
Thank you very much.